Question 1. Market research demonstrates a growing concern among ophthalmologists regarding the increasing prevalence of antibiotic-resistant bacteria affecting the ocular surface. In a patient presenting with a moderate case of bacterial keratitis, which of the following strategies best balances the need for effective treatment with the principles of antimicrobial stewardship and patient safety? Option A. Initiate empirical treatment with a broad-spectrum topical fluoroquinolone, with close monitoring for improvement and consideration of adding a fortified topical antibiotic, or switching to systemic therapy if there is no rapid response or signs of deeper stromal involvement. Option B. Rely solely on a mild, broad-spectrum topical antibiotic ointment, assuming that most ocular surface infections will resolve with conservative management, and avoid systemic agents unless the condition becomes severe. Option C. Immediately prescribe a systemic broad-spectrum antibiotic, such as oral levofloxacin, to ensure adequate drug levels throughout the ocular tissues, and defer topical treatment unless specifically indicated. Option D. Prescribe a topical antibiotic based on the patient's expressed preference for a particular brand, without a thorough clinical assessment of the likely causative organism or the need for systemic intervention. Correct answer is A. Initiate empirical treatment with a broad-spectrum topical fluoroquinolone, with close monitoring for improvement and consideration of adding a fortified topical antibiotic, or switching to systemic therapy if there is no rapid response or signs of deeper stromal involvement. Explanation. This scenario is professionally challenging because the choice between topical and systemic antibiotics for ocular surface disease, particularly when infection is suspected, requires a nuanced understanding of microbial resistance, drug penetration, patient factors, and the potential for adverse effects. Misjudging the appropriate antibiotic strategy can lead to treatment failure, prolonged discomfort, vision impairment, and the development of antibiotic resistance, which is a significant public health concern. Careful judgment is required to balance efficacy with minimizing harm and adhering to best practices in antimicrobial stewardship. The correct approach represents best professional practice because it prioritizes a targeted and evidence-based strategy that considers the likely causative agents, the severity of the condition, and the pharmacokinetic properties of the chosen antibiotic. This approach aligns with regulatory guidelines that emphasize appropriate antibiotic use to prevent resistance and ensure patient safety. By selecting an antibiotic with a spectrum of activity that covers common pathogens while considering local resistance patterns and the ability of the drug to reach the ocular surface effectively, the clinician maximizes the chance of successful treatment while minimizing systemic exposure and potential side effects. This also reflects ethical obligations to provide competent care and act in the patient's best interest. An incorrect approach that relies solely on broad-spectrum topical antibiotics without considering the possibility of deeper ocular involvement or systemic spread fails to adequately address potentially serious infections and contributes to unnecessary exposure to topical agents, which can cause ocular surface toxicity. This approach may also overlook the need for systemic therapy when indicated, leading to treatment failure. Another incorrect approach that immediately resorts to systemic antibiotics for all suspected ocular surface infections, even mild ones, is suboptimal. This can lead to unnecessary systemic side effects, contribute to the development of systemic antibiotic resistance. It may not be the most effective way to deliver the antibiotic to the site of infection on the ocular surface. It also fails to consider the potential for topical agents to be sufficient and less invasive. A further incorrect approach that involves prescribing antibiotics based on patient preference rather than clinical evidence and diagnostic findings disregards professional responsibility and the principles of evidence-based medicine. This can lead to inappropriate treatment, potential harm, and a failure to meet professional standards of care. The professional decision-making process for similar situations should involve a thorough clinical assessment, including a detailed history, slit lamp examination, and potentially microbiological investigations if indicated. This assessment should guide the selection of an antibiotic based on the suspected pathogen, the site and severity of infection, local resistance patterns, and the patient's individual characteristics. Adherence to antimicrobial stewardship principles, which advocate for the judicious use of antibiotics, is paramount. This includes using the narrowest spectrum antibiotic effective for the shortest duration necessary and considering topical versus systemic routes based on the specific clinical context. Question 2. Process analysis reveals a patient presenting with progressive blurred vision and photophobia. Clinical examination shows bilateral, symmetrical opacities in the corneal stroma. Given the potential for various inherited corneal dystrophies, what is the most appropriate next step in the diagnostic and management pathway to ensure optimal patient care and adherence to best practices? Option A. Proceed directly to a penetrating keratoplasty for both eyes to address the visual impairment. Option B. Perform advanced imaging such as anterior segment optical coherence tomography, ASOCT, and consider genetic testing to confirm the specific type of corneal dystrophy. Option C. Initiate empirical treatment with topical corticosteroids and lubricants while awaiting further specialist referral. Option D. Advise the patient that these symptoms are likely age-related and monitor for significant vision decline. The correct answer is C. Initiate empirical treatment with topical corticosteroids and lubricants while awaiting further specialist referral. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the practitioner to balance the immediate need for diagnostic clarity and patient reassurance with the long-term implications of a corneal dystrophy diagnosis. The practitioner must consider the potential for progressive vision loss, the impact on the patient's quality of life, and the availability of various management strategies, some of which may be invasive or have significant side effects. Furthermore, the practitioner must ensure that the diagnostic and management plan aligns with current best practices and regulatory guidelines for ocular surface disease management, which emphasize patient-centered care and informed consent. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based diagnostic pathway that directly addresses the suspected corneal dystrophy. This involves utilizing advanced imaging techniques and, if necessary, genetic testing to confirm the specific type of dystrophy. This detailed diagnosis is crucial for accurate prognosis and for tailoring the most appropriate management plan, which could range from conservative medical management to surgical interventions like keratoplasty. This approach aligns with the ethical imperative to provide competent and individualized care, ensuring that treatment decisions are informed by the most precise diagnostic information available. It also adheres to the principles of patient autonomy by facilitating informed consent based on a clear understanding of the condition. Incorrect approaches analysis. One incorrect approach involves solely relying on initial clinical examination and prescribing empirical treatment without definitive diagnostic confirmation. This fails to meet the standard of care for suspected corneal dystrophies, as many types have distinct genetic underpinnings and progression rates, necessitating specific diagnostic confirmation. This approach risks inappropriate treatment, delayed definitive management, and potential patient harm due to ineffective or contraindicated therapies. Ethically, it breaches the duty of care by not pursuing the most accurate diagnosis. Another incorrect approach is to immediately recommend aggressive surgical intervention without exhausting less invasive diagnostic and management options. This overlooks the potential for medical management or the possibility that the dystrophy might be stable or manageable conservatively. It also fails to adequately inform the patient about the full spectrum of options and their associated risks and benefits, potentially violating the principle of informed consent. Regulatory frameworks often emphasize a stepwise approach to treatment, starting with the least invasive effective option. A third incorrect approach is to dismiss the patient's symptoms as age-related or nonspecific, without a thorough investigation into the possibility of a corneal dystrophy. This can lead to a misdiagnosis, allowing the condition to progress unchecked and potentially causing irreversible vision loss. It demonstrates a failure to adhere to the professional obligation to investigate presenting symptoms diligently and to consider differential diagnoses, particularly when the patient's history and initial findings suggest a specific pathology. Professional reasoning. Professionals should approach suspected corneal dystrophies with a systematic diagnostic process. This begins with a detailed patient history, including family history of eye conditions, followed by a comprehensive slit lamp examination. If a dystrophy is suspected, advanced imaging such as anterior segment optical coherence tomography, ASOCT, or confocal microscopy should be considered to characterize the corneal changes. Genetic testing may be indicated for certain dystrophies to confirm the diagnosis and guide prognosis. Once a definitive diagnosis is established, A personalized management plan should be developed in collaboration with the patient, considering the specific type and severity of the dystrophy, the patient's visual needs, and available treatment options, including medical therapy, laser procedures, or keratoplasty. This decision-making process emphasizes evidence-based practice, patient-centered care, and adherence to ethical and regulatory standards. Question 3. During the evaluation of a patient experiencing new-onset dry eye symptoms, which of the following approaches best reflects adherence to regulatory guidelines and professional best practices concerning medications and their effects on the ocular surface? Option A. Conduct a thorough ocular surface examination. Review the patient's complete medication list for potential ocular side effects, and discuss management strategies with the patient. Option B. Focus solely on the patient's reported symptoms and recommend over-the-counter lubricants without investigating the underlying cause or potential medication contributions. Option C. Immediately discontinue the patient's systemic medication without consulting their prescribing physician, attributing all symptoms to this drug. Option D. Prescribe artificial tears and advise the patient to monitor symptoms, assuming the dry eye is unrelated to their current systemic medication regimen. The correct answer is D. Prescribe artificial tears and advise the patient to monitor symptoms, assuming the dry eye is unrelated to their current systemic medication regimen. Explanation: scenario analysis. This scenario presents a professional challenge due to the potential for iatrogenic ocular surface disease caused by prescribed medications. The practitioner must balance the therapeutic benefits of a medication with its known or potential adverse effects on the ocular surface. This requires a thorough understanding of pharmacology, ocular surface physiology, and patient-specific risk factors. The challenge is amplified by the need to adhere to regulatory guidelines regarding prescribing practices and patient counseling, ensuring informed consent and appropriate management of side effects. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's ocular surface health prior to and during treatment with medications known to affect it. This includes a detailed history, slit lamp examination, and potentially specialized tests to evaluate tear film stability, conjunctival health, and corneal integrity. The practitioner must then correlate any observed ocular surface changes with the prescribed medication, considering the drug's mechanism of action and known side effects. Proactive management, such as prescribing artificial tears, punctal plugs, or topical anti-inflammatories, and regular follow-up are crucial to mitigate or treat drug-induced ocular surface disease. This aligns with the ethical and regulatory imperative to provide patient-centered care, minimize harm, and ensure optimal treatment outcomes. Adherence to prescribing guidelines and professional standards of care is paramount. Incorrect approaches analysis. One incorrect approach is to attribute all ocular surface symptoms solely to pre-existing conditions without considering the potential contribution of prescribed medications. This failure to investigate medication-induced effects constitutes a breach of professional duty and regulatory oversight, potentially leading to delayed or incorrect diagnosis and treatment, and exacerbating the patient's condition. Another incorrect approach is to discontinue a potentially necessary medication without a thorough evaluation of its impact on the ocular surface and exploration of alternative treatments or supportive measures. This can compromise the management of the underlying condition for which the medication was prescribed and may not be in the patient's best interest, especially if the ocular side effects are manageable. A third incorrect approach is to fail to adequately counsel the patient on the potential ocular side effects of prescribed medications. This violates the principle of informed consent and leaves the patient unprepared to recognize and report symptoms, hindering timely intervention and potentially leading to more severe ocular surface damage. Regulatory frameworks emphasize patient education and shared decision-making. Professional reasoning. Professionals should adopt a systematic approach when evaluating patients on medications that can affect the ocular surface. This involves 1. Obtaining a comprehensive medical and ocular history, specifically inquiring about current medications and any associated symptoms. 2. Performing a thorough ocular examination, paying close attention to the ocular surface. 3. Considering the pharmacological profile of all prescribed medications and their known ocular side effects. 4. Correlating clinical findings with medication use. 5. Developing a management plan that may include supportive care, medication adjustment, or alternative therapies. And 6. providing clear and comprehensive patient education regarding potential side effects and the importance of follow-up. This structured approach ensures patient safety, adherence to regulatory requirements, and the delivery of high-quality care. Question 4. The efficiency study reveals that practitioners are exhibiting varying levels of diagnostic thoroughness when evaluating patients presenting with symptoms suggestive of ocular surface disease. Specifically, there is a notable divergence in how the integrity of the corneal epithelium is assessed in relation to the stability and composition of the tear film. Which of the following diagnostic strategies best reflects a comprehensive and integrated understanding of ocular surface anatomy and physiology for accurate OSD assessment? Option A. Prioritizing the assessment of tear film stability, such as tear breakup time, alongside vital staining of the corneal epithelium to identify punctate epithelial erosions or frank epithelial defects. Option B. Conducting a detailed examination of the meibomian glands and eyelid margins, assuming that any epithelial compromise is a direct consequence of meibomian gland dysfunction. Option C. Relying solely on patient-reported symptom severity scores and correlating them with the presence of any visible conjunctival injection. Option D. Focusing primarily on measuring tear film osmolarity and assessing the presence of mucin strands in the tear film, with minimal emphasis on direct visualization of epithelial integrity. The correct answer is A. Prioritizing the assessment of tear film stability, such as tear breakup time, alongside vital staining of the corneal epithelium to identify punctate epithelial erosions or frank epithelial defects. Explanation. The efficiency study reveals a discrepancy in how different practitioners approach the assessment of ocular surface health, specifically concerning the interplay between the corneal epithelium and the tear film. This scenario is professionally challenging because subtle differences in anatomical understanding and physiological interpretation can lead to misdiagnosis, delayed treatment, or inappropriate management of ocular surface disease (OSD). Accurate assessment requires a nuanced understanding of how these components interact and how their integrity is maintained. The correct approach emphasizes a comprehensive evaluation of both the corneal epithelial integrity and the tear film stability, recognizing their interdependent relationship in maintaining a healthy ocular surface. This aligns with best professional practice by ensuring that diagnostic efforts are not siloed, but rather integrated, reflecting the complex pathophysiology of OSD. Regulatory frameworks and professional guidelines for ocular surface disease management, such as those implicitly guiding the Certified in Ocular Surface Disease (COSD) certification, mandate thorough and accurate patient assessment. This approach ensures that all contributing factors to OSD are considered, leading to more effective and patient-centered care. An incorrect approach that focuses solely on epithelial defects, without adequately assessing tear film abnormalities, fails to acknowledge the foundational role of the tear film in epithelial health. This can lead to overlooking underlying causes of epithelial breakdown, such as evaporative dry eye or mucin deficiency, resulting in recurrent or persistent OSD. Ethically, this represents a failure to provide comprehensive care and could be considered a breach of professional duty to diagnose and manage the condition effectively. Another incorrect approach that prioritizes tear film osmolarity measurements above all else, while important, can be misleading if epithelial health is not simultaneously evaluated. Normal osmolarity reading does not preclude significant epithelial compromise, and vice versa. This narrow focus can lead to a false sense of security or an incomplete picture of the patient's condition, potentially delaying necessary interventions for epithelial damage. This approach could be seen as a failure to adhere to established diagnostic protocols for OSD, which require a multifaceted assessment. A further incorrect approach that solely relies on subjective patient-reported symptoms without objective clinical findings neglects the critical need for empirical evidence in diagnosis. While symptoms are vital for understanding the patient's experience, they must be corroborated by objective signs of ocular surface compromise. Relying solely on symptoms can lead to misdiagnosis, particularly in cases where patients may under- or over-report their discomfort, or where symptoms are atypical. This approach deviates from the evidence-based practice expected within OSD management. The professional decision-making process for similar situations should involve a systematic multimodal assessment of the ocular surface. This includes evaluating the tear film, e.g., tear breakup time, tear meniscus height, osmolarity, the corneal and conjunctival epithelium e.g., vital staining with fluorescein or lissamine green, and the eyelids and adnexa. Understanding the physiological interdependence of these structures is paramount. Professionals must integrate subjective patient history with objective clinical findings, critically analyzing how each component contributes to the overall health or disease of the ocular surface, and then formulating a management plan that addresses the root causes. Question 5. The efficiency study reveals that a significant number of patients presenting with symptoms of ocular surface disease are being managed with broad-spectrum treatments without a definitive etiological diagnosis. A 55-year-old female presents with chronic, intermittent burning, foreign body sensation, and blurred vision, particularly in the afternoon. Her history includes long hours working on a computer, a history of rosacea, and she uses over-the-counter artificial tears daily. Based on this presentation, which of the following diagnostic considerations is most crucial for establishing an accurate etiology and guiding appropriate management? Option A. A referral to an ophthalmologist for a corneal transplant evaluation, given the chronic nature of her symptoms. Option B. A trial of oral antibiotics to address a presumed infectious cause of her ocular surface irritation. Option C. Thorough assessment of meibomian gland function and tear film quality to investigate for evaporative dry eye secondary to meibomian gland dysfunction, MGD, and potential contributions from her rosacea. Option D. Immediate prescription of topical corticosteroids to reduce inflammation, assuming an allergic or inflammatory etiology. The correct answer is C. Thorough assessment of meibomian gland function and tear film quality to investigate for evaporative dry eye secondary to meibomian gland dysfunction, MGD, and potential contributions from her rosacea. Explanation. This scenario presents a professional challenge because it requires the practitioner to differentiate between various etiologies of ocular surface disease (OSD), based on clinical presentation and patient history, while adhering strictly to the diagnostic and management guidelines relevant to the Certified in Ocular Surface Disease (COSD) certification. The core difficulty lies in accurately identifying the underlying cause of the patient's symptoms to ensure appropriate and effective treatment, avoiding misdiagnosis which can lead to delayed recovery, increased patient discomfort, and potential complications. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based diagnostic process. This involves a thorough patient history to uncover potential contributing factors, e.g., environmental exposures, systemic conditions, medication use, followed by a comprehensive clinical examination including slit lamp biomicroscopy, vital staining, and potentially specialized tests like tear film osmolarity or meibography. This methodical approach aligns with the COSD emphasis on a deep understanding of OSD etiology and the application of this knowledge to patient care. By focusing on identifying the root cause, the practitioner can tailor treatment strategies, which is ethically sound and professionally responsible, ensuring patient safety and optimal outcomes. An incorrect approach that focuses solely on symptomatic relief without investigating the underlying cause is professionally unacceptable. This fails to address the etiology of the OSD, potentially leading to chronic or worsening symptoms and overlooking serious underlying conditions. Ethically, this approach breaches the duty of care by not providing a complete and accurate diagnosis. Another incorrect approach might involve prematurely attributing the OSD to a single, common cause without considering differential diagnoses, which can lead to misdiagnosis and inappropriate treatment. This demonstrates a lack of thoroughness and adherence to best practices in differential diagnosis, a core competency for COSD certification. A further incorrect approach could be to rely on anecdotal evidence or unverified patient self-diagnosis, which disregards established clinical protocols and evidence-based medicine, posing a risk to patient well-being and violating professional standards. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive history taking. Elicit detailed information about symptom onset, duration, severity, aggravating/alleviating factors, past ocular and systemic medical history, current medication, and lifestyle. 2. Clinical examination. Perform a systematic ocular examination, including visual acuity, external examination, slit lamp biomicroscopy with attention to the eyelids, conjunctiva, cornea, and tear film. Utilize appropriate diagnostic stains. 3. Differential diagnosis. Based on the history and examination findings, formulate a list of potential etiologies for the OSD. 4. Targeted investigations. If necessary, order further diagnostic tests to confirm or rule out specific etiologies. 5. Diagnosis and treatment plan. Establish a definitive diagnosis and develop a personalized treatment plan that addresses the identified etiology. 6. Patient education and follow-up. Educate the patient about their condition, treatment plan, and the importance of adherence. Schedule appropriate follow-up appointments to monitor progress and adjust treatment as needed. Question 6. Regulatory review indicates that a patient presents with bilateral ocular discomfort, redness, and fluctuating blurred vision. Initial examination reveals mild conjunctival injection and a slightly unstable tear film, but no overt signs of infection or epithelial defects. Considering the complex immune response of the ocular surface, which of the following approaches best optimizes the diagnostic and therapeutic process for this patient? Option A. Initiate empirical treatment with broad-spectrum topical antibiotics to address potential subclinical infection. Option B. Conduct a thorough diagnostic workup to identify the underlying cause of the ocular surface inflammation and tear film instability before initiating treatment. Option C. Recommend frequent use of artificial tears for symptomatic relief while awaiting spontaneous resolution of the symptoms. Option D. Prescribe a course of topical corticosteroids to rapidly reduce inflammation and alleviate symptoms. The correct answer is A. Initiate empirical treatment with broad-spectrum topical antibiotics to address potential subclinical infection. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of the ocular surface immune response and the potential for misinterpretation of clinical findings. The ocular surface is a unique immunological environment, constantly exposed to external antigens, while maintaining immune tolerance to prevent inflammation that could compromise vision. Differentiating between a normal, protective immune response and an aberrant, disease-causing one requires a nuanced understanding of cellular and molecular mediators. Furthermore, the rapid progression of some ocular surface diseases necessitates timely and accurate diagnosis and management, making process optimization crucial for patient outcomes. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's clinical presentation, integrating findings from a comprehensive ocular examination with an understanding of the underlying immunological mechanisms of the ocular surface. This includes assessing for signs of inflammation, e.g., conjunctival injection, corneal infiltrates, epithelial defects, evaluating the tear film stability, and considering the patient's history for predisposing factors or previous ocular surface issues. The rationale for this approach is rooted in the principles of evidence-based medicine and best practice guidelines for ocular surface disease management, which emphasize a thorough diagnostic workup before initiating treatment. This ensures that interventions are targeted, effective, and minimize the risk of iatrogenic harm. Incorrect approach is analysis. Initiating broad-spectrum topical antibiotic therapy without a clear indication of bacterial infection represents a failure to adhere to judicious prescribing practices. This approach risks promoting antibiotic resistance, disrupting the ocular surface microbiome, and masking underlying inflammatory or immune-mediated conditions. It bypasses the critical step of differential diagnosis, which is a cornerstone of ethical and effective patient care. Prescribing topical corticosteroids as a first-line treatment for all signs of ocular surface inflammation is also an inappropriate approach. While corticosteroids can suppress inflammation, their indiscriminate use can lead to significant side effects, including elevated intraocular pressure, cataract formation, and increased susceptibility to infections. This approach neglects the need to identify the specific cause of inflammation and may exacerbate certain underlying conditions. Focusing solely on symptomatic relief, such as artificial tears, without addressing the root cause of the immune dysregulation, is another incorrect approach. While artificial tears can provide comfort, they do not resolve the underlying immunological imbalance driving the ocular surface disease. This approach fails to provide definitive treatment and can lead to a delay in appropriate management, potentially resulting in irreversible ocular surface damage. Professional reasoning. Professionals should adopt a structured diagnostic framework when managing ocular surface disease. This involves 1. Detailed history taking, including symptoms, duration, and previous treatments. 2. comprehensive ocular examination, including slit lamp biomicroscopy, your film assessment and vital staining. 3. Consideration of differential diagnoses based on clinical findings, encompassing infectious, inflammatory, immune-mediated, and degenerative causes. 4. Targeted investigations if necessary, e.g., microbial cultures, immunofluorescence. And 5. Development of a treatment plan tailored to the specific diagnosis, prioritizing evidence-based interventions and monitoring for efficacy and adverse effects. This systematic process ensures patient safety, optimizes treatment outcomes, and upholds professional standards. Question 7. Compliance review shows a practitioner consistently attributes all ocular surface disease symptoms solely to a deficiency in the aqueous component of the tear film, neglecting the contributions of the lipid and mucin layers to tear film stability and function. Which of the following diagnostic and management approaches best reflects a comprehensive understanding of tear film composition and dynamics in the context of ocular surface disease? Option A. Evaluating the integrity and function of all three tear film layers, lipid, aqueous, and mucin, and their dynamic interactions to identify specific deficits contributing to the patient's ocular surface disease. Option B. Primarily assessing the lipid layer's evaporative resistance, as evaporative dry eye is the most common form of ocular surface disease and dictates treatment. Option C. Prioritizing the assessment of mucin production and its role in tear film spreading, as this is the most critical factor for maintaining ocular surface wettability. Option D. Focusing exclusively on measuring tear film osmolarity to assess the severity of aqueous deficiency, as this is the primary determinant of ocular surface discomfort. The correct answer is A. Evaluating the integrity and function of all three tear film layers, lipid, aqueous, and mucin, and their dynamic interactions to identify specific deficits contributing to the patient's ocular surface disease. Explanation. Scenario analysis. This scenario presents a professional challenge in interpreting and applying the nuances of tear film composition and dynamics within the context of ocular surface disease management. The challenge lies in distinguishing between normal physiological variations and pathological changes that significantly impact patient outcomes. A practitioner must possess a deep understanding of the layered structure of the tear film, the roles of its lipid, aqueous, and mucin components, and how their dynamic interactions are crucial for maintaining ocular health. Misinterpreting these components or their dynamics can lead to incorrect diagnoses, inappropriate treatment strategies, and ultimately, suboptimal patient care, potentially violating professional standards of practice. Correct approach analysis. The correct approach involves a comprehensive assessment of the tear film's functional integrity, considering the interplay of all its components. This includes evaluating the lipid layer's stability, the aqueous layer's volume and evaporative rate, and the mucin layer's ability to promote wettability and spreadability. A thorough understanding of how deficiencies or imbalances in these layers contribute to specific ocular surface disease presentations, such as evaporative dry eye or aqueous deficient dry eye, is paramount. This approach aligns with best professional practice by prioritizing a holistic and evidence-based evaluation of the ocular surface, ensuring that diagnostic and therapeutic decisions are grounded in a precise understanding of the underlying pathophysiology. This aligns with the ethical obligation to provide competent and evidence-based care, ensuring patient safety and well-being. Incorrect approaches analysis, focusing solely on the aqueous component of the tear film, while important, represents an incomplete assessment. This approach fails to acknowledge the critical role of the lipid and mucin layers in tear film stability and evaporation. Such a narrow focus could lead to misdiagnosis, particularly in cases of evaporative dry eye, where the aqueous layer may appear normal, but the lipid layer is compromised. This constitutes a failure to meet the standard of care by not performing a comprehensive evaluation, potentially leading to inappropriate treatment and patient harm. Prioritizing only the mucin layer's contribution to wettability overlooks the significant impact of aqueous deficiency and lipid evaporation on overall tear film homeostasis. While mucins are vital for spreading and adherence, their effectiveness is diminished if the aqueous layer is insufficient or if the lipid layer is unstable, leading to rapid evaporation. This incomplete understanding can result in ineffective treatment strategies and a failure to address the root cause of the patient's symptoms, violating the professional duty to provide effective care. Considering only the lipid layer's role in preventing evaporation, without accounting for the aqueous volume and mucin function, is also an insufficient approach. While a stable lipid layer is crucial for reducing evaporation, a healthy aqueous layer and functional mucin are necessary to maintain adequate tear film thickness and distribution. Neglecting these aspects can lead to a mischaracterization of the disease process and the selection of treatments that do not fully address the patient's condition, thereby failing to uphold professional standards of care. Professional reasoning. Professionals should adopt a systematic decision-making framework that begins with a thorough patient history and symptom assessment, followed by a comprehensive clinical examination. This examination must include objective measures of tear film components and dynamics, such as tear breakup time, Skirmer's test, osmolarity, and meibomian gland evaluation. The interpretation of these findings should be integrated to form a cohesive understanding of the ocular surface's functional status. When faced with complex presentations, professionals should consult current evidence-based guidelines and, if necessary, seek peer consultation to ensure the most accurate diagnosis and effective management plan. This iterative process of assessment, diagnosis, and treatment adjustment, guided by a deep understanding of tear film physiology, is essential for optimal patient outcomes and adherence to professional and ethical standards. Question 8. The control framework reveals a scenario where a patient presents with a suspicious lesion on the ocular surface that exhibits characteristics concerning for ocular surface squamous neoplasia OSSEN. Considering the regulatory guidelines for managing such conditions, which of the following represents the most appropriate initial management strategy to ensure patient safety and adherence to best practices? Option A. Perform an excisional biopsy of the lesion in the clinic without prior histopathological confirmation of the diagnosis. Option B. Advise the patient that the lesion appears benign and recommend observation with no immediate intervention. Option C. Initiate empirical treatment with broad-spectrum topical antibiotics and anti-inflammatory drops and schedule a follow-up appointment in 6 weeks to reassess the lesion. Option D. Immediately refer the patient to a specialist in ocular oncology or oculoplastics for a definitive diagnosis and management plan, including biopsy if indicated. The correct answer is C. Initiate empirical treatment with broad-spectrum topical antibiotics and anti-inflammatory drops and schedule a follow-up appointment in 6 weeks to reassess the lesion. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misdiagnosis and delayed treatment of ocular surface squamous neoplasia, OSSEN. OSSEN, while often appearing benign, can mimic other, less serious conditions, necessitating a high degree of clinical suspicion and adherence to established diagnostic and management protocols. The challenge lies in balancing timely intervention with appropriate diagnostic pathways, ensuring patient safety and optimal outcomes while navigating regulatory expectations for care. Correct approach analysis. The correct approach involves a systematic and evidence-based management strategy for suspected OSSEN. This includes thorough clinical examination, appropriate diagnostic investigations such as biopsy and histopathological examination, and referral to a specialist for definitive management. This aligns with the principles of good clinical practice and regulatory guidelines that emphasize accurate diagnosis, appropriate treatment, and patient safety. Specifically, it reflects the regulatory expectation for healthcare professionals to act within their scope of practice, utilize validated diagnostic tools, and ensure patients receive timely and effective care for potentially serious conditions. The emphasis on biopsy and specialist referral directly addresses the need for definitive diagnosis and management of OSSEN, minimizing the risk of undertreatment or progression. Incorrect approaches analysis. One incorrect approach involves relying solely on topical medications without a definitive diagnosis. This fails to address the underlying pathology of OSSEN and could lead to disease progression, potentially impacting vision and requiring more aggressive treatment later. This approach represents a regulatory and ethical failure by not adhering to the standard of care for suspected neoplastic lesions and potentially violating patient safety principles by delaying appropriate intervention. Another incorrect approach is to dismiss the lesion as a benign condition based on initial visual inspection alone, without pursuing further diagnostic confirmation. This overlooks the possibility of malignancy and carries significant risks for the patient. This constitutes a failure to meet the regulatory requirement for due diligence in diagnosis and a breach of ethical responsibility to investigate potentially serious conditions thoroughly. A third incorrect approach might involve performing an excisional biopsy in an office setting without appropriate histopathological confirmation of the diagnosis, and without considering the potential for recurrence or the need for adjuvant therapy. While excisional biopsy can be part of management, performing it without a confirmed diagnosis or a clear management plan based on pathology reports is premature and potentially suboptimal. This could lead to incomplete treatment or unnecessary procedures, failing to meet the regulatory standard for evidence-based and patient-centered care. Professional reasoning. Professionals encountering suspected OSIN should adopt a decision-making process that prioritizes accurate diagnosis and evidence-based management. This involves 1. Maintaining a high index of suspicion for OSIN, especially in patients with risk factors or characteristic clinical features. 2. Performing a comprehensive ocular surface examination. 3. Recognizing the limitations of clinical diagnosis alone and understanding when further investigation is warranted. 4. Initiating appropriate diagnostic procedures, such as a biopsy, to obtain a definitive histopathological diagnosis. 5. Consulting with or referring to a specialist, e.g., ophthalmologist with expertise in ocular oncology or oculoplastics, for definitive management based on the biopsy results. 6. Adhering to established treatment protocols and follow-up schedules to monitor for recurrence or complications. This systematic approach ensures patient safety, optimizes treatment outcomes, and upholds professional and regulatory standards. Question 9. Implementation of a standardized grading scale for meibomian gland expression and secretion quality during a comprehensive ocular surface disease evaluation is considered best practice for managing patients presenting with symptoms suggestive of meibomian gland dysfunction. Which of the following approaches best reflects this principle? Option A. Relying solely on patient-reported symptom severity to initiate treatment for meibomian gland dysfunction. Option B. Prescribing topical antibiotics for an extended period without objective evidence of bacterial infection or inflammation directly linked to meibomian gland dysfunction. Option C. Assessing only the visible morphology of the meibomian glands without evaluating the ease of expression or the quality of the secreted meibum. Option D. Utilizing a validated grading system to assess meibomian gland expressibility and the quality of the meibum, integrating these findings with patient symptoms to guide therapeutic interventions. The correct answer is A. Relying solely on patient-reported symptom severity to initiate treatment for meibomian gland dysfunction. Explanation. This scenario presents a common challenge in ocular surface disease management, balancing patient-reported symptoms with objective clinical findings, particularly concerning the meibomian glands. The professional challenge lies in accurately assessing the functional status of these glands, which are crucial for tear film stability, and then tailoring treatment based on this assessment. Misinterpreting the role or condition of the meibomian glands can lead to ineffective treatment, patient dissatisfaction, and potentially the progression of ocular surface disease. Careful judgment is required to differentiate between various causes of dry eye and to implement evidence-based interventions. The correct approach represents best professional practice because it directly addresses the underlying pathophysiology of meibomian gland dysfunction, MGD, by incorporating a standardized, objective assessment method. Utilizing a validated grading scale for meibomian gland expression and quality, as advocated by current best practice guidelines for ocular surface disease, allows for more precise diagnosis and targeted therapy. This aligns with the ethical obligation to provide patient-centered care based on accurate clinical data, ensuring that interventions are appropriate and effective. Adherence to such systematic evaluation promotes consistent and reproducible patient care, which is a hallmark of professional excellence in this field. An incorrect approach that relies solely on patient symptom reporting without objective gland assessment fails to acknowledge the complex nature of MGD. While symptoms are important, they can be subjective and influenced by factors other than gland function. This approach risks misdiagnosing the primary cause of the patient's discomfort, leading to inappropriate treatment and a lack of improvement. Ethically, it falls short of providing the highest standard of care by not thoroughly investigating the root cause. Another incorrect approach that focuses only on superficial gland appearance without assessing expressibility or secretion quality overlooks the functional aspect of MGD. Glands may appear morphologically intact, but be unable to secrete adequate sebum. This superficial assessment can lead to an underestimation of MGD severity and a failure to implement necessary treatments like gland expression or thermal pulsation. This represents a failure to apply current, evidence-based diagnostic criteria for MGD. A further incorrect approach that prescribes broad-spectrum antibiotic therapy without a clear indication of bacterial involvement or specific MGD-related inflammation neglects the targeted nature of effective MGD management. While some inflammatory components can be present, antibiotics are not a first-line treatment for MGD itself and can disrupt the ocular microbiome. This approach is not supported by current best practices for MGD and could lead to unnecessary side effects and resistance. The professional decision-making process for similar situations should involve a systematic approach. 1. Elicit a thorough patient history, including symptom severity and duration. 2. Conduct a comprehensive ocular surface examination, including vital staining, tear breakup time, and importantly, a standardized assessment of meibomian gland function, expression, quality of secretion. 3. Correlate objective findings with subjective symptoms to establish a diagnosis. 4. Develop a treatment plan that is evidence-based and targets the identified underlying mechanisms, with regular follow-up to assess efficacy and adjust as needed. Question 10. The control framework reveals a patient presenting with significant photophobia and blurred vision. During examination, a diffuse stromal infiltrate is noted. Considering the layered structure of the cornea, which of the following diagnostic and management strategies best reflects a best practice approach for this specific presentation? Option A. Prescribe topical corticosteroids immediately to reduce inflammation associated with the infiltrate. Option B. Utilize anterior segment optical coherence tomography, ASOCT, to precisely delineate the stromal infiltrate and guide targeted antimicrobial or anti-inflammatory therapy based on its depth and characteristics. Option C. Initiate broad-spectrum topical antibiotic therapy and schedule a follow-up in 1 week. Option D. Perform a detailed assessment of the corneal epithelium for any defects and consider a trial of lubricating eye drops. The correct answer is C. Initiate broad-spectrum topical antibiotic therapy and schedule a follow-up in 1 week. Explanation. Scenario analysis. This scenario presents a professional challenge in accurately diagnosing and managing a patient's ocular surface disease. The challenge lies in the subtle yet critical differences in how various corneal layers respond to disease processes and treatments. Misinterpreting the affected corneal layer can lead to inappropriate therapeutic choices, potentially exacerbating the condition, delaying recovery, or causing iatrogenic harm. The professional must exercise careful judgment, integrating clinical signs with a precise understanding of corneal anatomy. Correct approach analysis. The correct approach involves a systematic evaluation that prioritizes identifying the specific corneal layer involved in the patient's disease. This is best professional practice because it directly informs the diagnostic pathway and guides therapeutic interventions. For instance, understanding whether the disease primarily affects the epithelium, Bowman's layer, stroma, Descemet's membrane, or endothelium dictates the choice of diagnostic tests, e.g., confocal microscopy for stromal infiltrates, specular microscopy for endothelial dysfunction, and the selection of appropriate medications, e.g., topical antibiotics for epithelial defects, anti-inflammatory agents for stromal keratitis, or hypotensive agents for endothelial decompensation. This precise anatomical localization ensures that treatment targets the root cause of the pathology, aligning with ethical obligations to provide competent and effective care, and adhering to the principles of evidence-based practice inherent in professional ocular surface disease management. Incorrect approaches analysis. One incorrect approach involves a generalized treatment strategy without pinpointing the affected corneal layer. This fails to acknowledge the distinct physiological and pathological characteristics of each layer. Ethically, this can be considered a failure to provide individualized care and may violate the principle of non-maleficence if the treatment is ineffective or harmful due to its broad application. From a regulatory perspective, it may fall short of the expected standard of care for a certified professional. Another incorrect approach is to rely solely on patient-reported symptoms without objective anatomical assessment. While symptoms are crucial, they are often nonspecific to individual corneal layers. This approach risks misdiagnosis and inappropriate treatment, potentially leading to complications. It represents a failure to employ appropriate diagnostic tools and a deviation from best practices in ocular surface disease management, which mandates objective findings to support clinical decisions. A third incorrect approach is to assume the most superficial layer is always the primary site of disease without further investigation. While epithelial involvement is common, deeper stromal or endothelial pathologies can present with superficial signs. This assumption can lead to overlooking critical underlying conditions, delaying appropriate management, and potentially causing irreversible damage to deeper corneal structures. This demonstrates a lack of thoroughness and a failure to adhere to a comprehensive diagnostic process. Professional reasoning. Professionals managing ocular surface disease should adopt a structured decision-making process. This begins with a thorough history and comprehensive slit lamp examination. When corneal pathology is suspected, the next critical step is to meticulously assess the involvement of each corneal layer, from the epithelium to the endothelium, using appropriate diagnostic aids such as fluorescein staining, anterior segment optical coherence tomography, ASOCT, confocal microscopy, or specular microscopy as indicated. This anatomical localization then guides the selection of investigations and the formulation of a targeted treatment plan. Regular follow-up and reassessment are essential to monitor treatment efficacy and adjust the plan as needed, always prioritizing patient safety and optimal visual outcomes. This systematic, anatomically informed approach ensures adherence to professional standards and regulatory expectations for competent care. Question 11. Strategic planning requires a proactive approach to patient care, especially when managing potential contact lens-related complications. A patient presents with sudden onset of severe eye pain, photophobia, and blurred vision in one eye, reporting they slept in their soft contact lenses the previous night. Upon examination, you observe significant conjunctival injection, a small corneal infiltrate with surrounding stromal edema, an anterior chamber reaction. What is the most appropriate immediate course of action? Option A. Immediately remove the contact lens, initiate empirical broad-spectrum topical antibiotic therapy, and arrange urgent referral to an ophthalmologist for further evaluation and management. Option B. Advise the patient to discontinue contact lens wear, use artificial tears, and schedule a follow-up appointment in 1 week. Option C. Recommend over-the-counter lubricating eye drops and suggest the patient try a different brand of contact lenses at their next purchase. Option D. Prescribe a mild topical steroid to reduce inflammation and advise the patient to continue wearing their contact lenses with a new pair. The correct answer is B. Advise the patient to discontinue contact lens wear, use artificial tears, and schedule a follow-up appointment in 1 week. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a patient presenting with a potentially sight-threatening condition directly linked to contact lens wear. The practitioner must quickly and accurately diagnose the complication, assess its severity, and initiate appropriate management while adhering to professional standards and patient safety protocols. The urgency of the situation, coupled with the need for precise clinical judgment, makes this a critical test of a practitioner's expertise in ocular surface disease and contact lens care. Correct approach analysis. The correct approach prioritizes immediate, thorough assessment and management of the suspected microbial keratitis. This aligns with best professional practice by placing patient safety and visual preservation above all else. Promptly removing the offending contact lens, initiating empirical broad-spectrum antibiotic therapy, and arranging urgent referral to an ophthalmologist are crucial steps in managing a sight-threatening infection. This proactive and evidence-based approach minimizes the risk of irreversible vision loss and adheres to the ethical obligation to provide timely and effective care. Regulatory frameworks for eye care professionals emphasize the duty of care and the importance of managing potentially serious conditions with appropriate urgency and expertise. Incorrect approaches analysis. One incorrect approach involves delaying treatment to gather more information or to wait for the patient to return for a scheduled follow-up. This fails to acknowledge the acute and potentially rapidly progressing nature of microbial keratitis, violating the duty of care and potentially leading to severe visual impairment. Ethically, this demonstrates a lack of urgency and a failure to prioritize patient well-being in a critical situation. Regulatory guidelines for managing infectious eye conditions, would mandate immediate intervention. Another incorrect approach might be to prescribe a less aggressive or narrower spectrum treatment without a definitive diagnosis, or to rely solely on over-the-counter remedies. This is professionally unacceptable, as it underestimates the severity of the suspected condition and could lead to treatment failure, disease progression, and permanent vision damage. It disregards established clinical protocols for managing suspected microbial keratitis, which typically involve empirical broad-spectrum coverage. A third incorrect approach could be to dismiss the patient's symptoms as minor irritation without a comprehensive examination, especially given the history of contact lens wear. This represents a significant diagnostic failure and a breach of professional responsibility. It ignores the well-established link between contact lens wear and serious microbial infections, potentially leading to delayed diagnosis and irreversible harm. Such an approach would be a clear violation of professional standards and ethical obligations. Professional reasoning. When faced with a patient presenting with symptoms suggestive of a contact lens-related complication, particularly those indicating potential infection, a practitioner should follow a structured decision-making process. This involves 1. Taking a detailed history, focusing on contact lens wear habits and symptom onset. 2. Performing a comprehensive slit lamp examination to assess the cornea, conjunctiva, and anterior chamber for signs of inflammation or infection. 3. Considering differential diagnoses with microbial keratitis being a high priority. 4. Initiating appropriate management based on the suspected diagnosis, which may include lens removal, empirical antimicrobial therapy, and urgent referral if indicated. 5. Documenting all findings, assessments, and management plans thoroughly. This systematic approach ensures that patient safety is paramount and that care is delivered in accordance with professional standards and regulatory requirements. Question 12. Strategic planning requires a COSD professional to consider how to best address a patient presenting with persistent, subjective visual disturbances, such as intermittent blurriness and halos, that are not readily explained by gross ocular pathology on initial examination, but where the patient strongly suspects an issue with their ocular surface. What is the most appropriate course of action to ensure optimal patient care and adherence to professional standards? Option A. Reassure the patient that their symptoms are likely psychosomatic due to the absence of objective findings, and advise them to focus on stress reduction techniques. Option B. Prescribe empirical treatment for a common ocular surface condition, such as artificial tears, without further diagnostic investigation, hoping for symptom resolution. Option C. Immediately refer the patient to a neuro-ophthalmologist, assuming the visual disturbances are indicative of a more complex neurological issue given the lack of obvious ocular surface findings. Option D. Conduct a comprehensive ocular surface evaluation, including detailed assessment of tear film stability, corneal and conjunctival staining, and lid margin health, to identify potential subtle signs of ocular surface disease that could manifest as visual disturbances, and manage accordingly or refer if indicated. Correct answer is D. Conduct a comprehensive ocular surface evaluation, including detailed assessment of tear film stability, corneal and conjunctival staining, and lid margin health, to identify potential subtle signs of ocular surface disease that could manifest as visual disturbances, and manage accordingly or refer if indicated. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's subjective experience of visual disturbance and the objective findings on examination, particularly when those findings are subtle or not immediately indicative of a severe ocular surface disease. The COSD professional must navigate the patient's distress and potential impact on their daily life, while adhering to evidence-based practice and regulatory guidelines for diagnosis and management. The challenge lies in validating the patient's concerns without over- or undertreating, ensuring appropriate referral, and maintaining clear communication. The correct approach represents best professional practice because it prioritizes patient-centered care and a thorough, systematic diagnostic process. It acknowledges the patient's reported symptoms as valid and initiates a comprehensive evaluation to identify the underlying cause, which may include subtle ocular surface disease. This aligns with regulatory frameworks that emphasize accurate diagnosis, appropriate management, and patient safety. By considering a differential diagnosis that includes ocular surface disease and its potential visual manifestations, the professional demonstrates adherence to established clinical protocols and ethical obligations to investigate symptoms thoroughly. Furthermore, this approach ensures that if ocular surface disease is indeed the cause, it is identified and managed promptly, preventing potential long-term complications and improving the patient's quality of life. An incorrect approach that dismisses the patient's visual disturbances without adequate investigation fails to meet professional standards. This could be considered a regulatory failure if it leads to a missed or delayed diagnosis of a treatable condition, potentially violating guidelines related to patient care and diagnostic accuracy. Ethically, it breaches the duty of care by not taking the patient's reported symptoms seriously. Another incorrect approach that immediately assumes a severe, unrelated pathology without first thoroughly evaluating the ocular surface would also be professionally unsound. A broad differential diagnosis is important. Neglecting the primary area of expertise and the most likely cause based on the patient's presentation would be a failure to apply specialized knowledge and could lead to unnecessary investigations or referrals, wasting resources and potentially causing patient anxiety. This could be seen as a deviation from best practice within the scope of ocular surface disease management. A third incorrect approach that involves prescribing aggressive, unproven treatments for visual disturbances without a clear diagnosis of ocular surface disease would be a significant regulatory and ethical breach. This could lead to iatrogenic harm, violate guidelines on evidence-based practice, and potentially expose the professional to liability. The professional decision-making process for similar situations should involve a structured approach. 1. Active listening and validation. Genuinely listen to the patient's description of their visual disturbances and acknowledge their impact. 2. Comprehensive history. Gather detailed information about the nature, onset, duration, triggers, and alleviating factors of the visual disturbances, as well as relevant ocular and systemic medical history. 3. Targeted ocular examination. Conduct a thorough examination of the ocular surface, including slit lamp biomicroscopy, vital staining, tear film assessment, and evaluation for signs of dry eye, blepharitis, conjunctivitis, or corneal pathology. 4. Differential diagnosis. Formulate a list of potential causes for the visual disturbances, prioritizing those related to ocular surface disease but also considering other possibilities. 5. Evidence-based management. Based on the findings, develop a management plan that is supported by evidence and aligns with regulatory guidelines. This may involve conservative management, specific treatments for ocular surface disease, or referral to other specialists if indicated. 6. Patient education and communication. Clearly explain the diagnosis, treatment plan, expected outcomes, and potential risks and benefits to the patient. Question 13. Investigation of a patient presenting with persistent, severe ocular discomfort disproportionate to clinical signs of surface damage requires a clinician to consider the intricate innervation of the ocular surface. Which of the following diagnostic and management strategies best reflects an understanding of this innervation and its implications for patient care? Option A. A reliance on artificial tears alone, with the expectation that lubrication will resolve all forms of ocular discomfort, irrespective of underlying neural mechanisms. Option B. A comprehensive assessment that integrates patient-reported sensory symptoms with objective findings, considering the role of trigeminal nerve branches and their modulation of inflammatory and trophic pathways to guide targeted therapeutic interventions. Option C. The empirical application of broad-spectrum antibiotic and anti-inflammatory drops, without a detailed evaluation of the specific sensory pathways contributing to the patient's pain. Option D. A primary focus on identifying and treating visible epithelial defects or inflammatory markers, assuming that symptom severity directly correlates with the extent of surface pathology. The correct answer is B. A comprehensive assessment that integrates patient-reported sensory symptoms with objective findings, considering the role of trigeminal nerve branches and their modulation of inflammatory and trophic pathways to guide targeted therapeutic interventions. Explanation. The scenario presents a common clinical challenge in ocular surface disease management, accurately assessing and addressing neuropathic pain. The innervation of the ocular surface is complex, involving multiple nerve branches and neurotransmitters, and dysfunction can lead to significant discomfort that may not correlate with visible signs of disease. A best practice approach requires a thorough understanding of this innervation to differentiate between various causes of ocular surface discomfort and to guide appropriate treatment. The correct approach represents best professional practice because it systematically evaluates the patient's symptoms in the context of the known neuroanatomy and physiology of the ocular surface. This involves considering the specific nerve pathways involved in sensation, inflammation, and healing. By correlating subjective complaints with objective findings and understanding the potential impact of treatments on nerve function, a clinician can develop a targeted and effective management plan. This aligns with the ethical imperative to provide patient-centered care and to utilize evidence-based practices. An incorrect approach that focuses solely on visible signs of ocular surface damage fails to acknowledge the significant role of neurotrophic factors and nerve dysfunction in ocular pain. This oversight can lead to misdiagnosis and ineffective treatment, prolonging patient suffering and potentially causing iatrogenic harm if treatments are applied without understanding their impact on nerve health. Another incorrect approach that relies on empirical treatment without a clear diagnostic rationale risks overtreatment or undertreatment and may not address the underlying neuropathic component. A failure to consider the specific innervation patterns and their implications for pain perception and healing constitutes a breach of professional standards by not employing a comprehensive diagnostic and therapeutic strategy. Professionals should approach such situations by first conducting a detailed history, focusing on the character, duration, and triggers of pain. This should be followed by a comprehensive ocular examination, including assessment of the cornea, conjunctiva, and eyelids. Crucially, the clinician must then integrate this information with their knowledge of ocular surface innervation to formulate a differential diagnosis. This involves considering conditions like corneal neuralgia, dry eye disease with a neuropathic component, or post-surgical pain. Treatment decisions should be guided by this integrated understanding, prioritizing interventions that address the identified underlying mechanisms, including those related to nerve function and inflammation. Question 14. What factors determine the appropriate management strategy for a patient presenting with a fleshy, triangular growth extending from the conjunctiva onto the cornea, considering both the lesion's characteristics and the patient's symptoms? Option A. The patient's insurance coverage and the cost-effectiveness of different treatment modalities, without primary consideration of clinical necessity. Option B. The availability of surgical resources and the practitioner's personal preference for managing ocular surface lesions. Option C. The patient's age and general health status, irrespective of the lesion's specific clinical presentation or symptomatic impact. Option D. The presence and severity of symptoms such as foreign body sensation, redness, and visual disturbance, in conjunction with the lesion's size, location, and degree of corneal involvement. Correct answer is D. The presence and severity of symptoms such as foreign body sensation, redness, and visual disturbance, in conjunction with the lesion's size, location, and degree of corneal involvement. Explanation. This scenario presents a common clinical challenge in ocular surface disease management, specifically concerning pterygium and pincula. The professional challenge lies in accurately differentiating these conditions, understanding their potential for progression, and recommending appropriate management strategies that align with patient needs and clinical best practices, all within the regulatory framework governing eye care professionals. The decision-making process requires a nuanced understanding of the etiology, clinical presentation, and potential impact on vision and comfort. The correct approach emphasizes a thorough clinical assessment, including a detailed patient history, slit lamp examination to characterize the lesion's size, location, and vascularity, and an evaluation of any associated symptoms or visual impairment. This aligns with the professional responsibility to provide evidence-based care and to accurately diagnose ocular conditions. The regulatory framework for ocular surface disease management, as implied by the COSD exam, mandates that practitioners base their decisions on sound clinical judgment and established diagnostic criteria. Recommending observation for asymptomatic, small pincula, or surgical intervention for symptomatic or visually significant pterygium reflects adherence to these principles. This approach prioritizes patient well-being and aims to prevent complications or vision loss. An incorrect approach might involve misclassifying a pterygium as a simple pincula due to superficial examination, leading to delayed or inappropriate management. This failure to accurately diagnose could result in the progression of the pterygium, potentially causing irreversible visual impairment or chronic discomfort, which would be a breach of professional duty of care. Another incorrect approach could be recommending aggressive surgical intervention for a benign, asymptomatic pincula, leading to unnecessary risks, costs, and patient morbidity, which deviates from the principle of judicious medical practice. Furthermore, failing to document the assessment and management plan thoroughly would violate record-keeping requirements and hinder continuity of care. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive patient history, including environmental exposures and symptoms. 2. Conduct a meticulous slit lamp examination, noting key features of the lesion. 3. Differentiate between pincula and pterygium based on established clinical definitions. 4. Assess the impact of the lesion on vision, ocular comfort, and potential for progression. 5. Formulate a management plan that is tailored to the individual patient's needs and the characteristics of the lesion, considering observation, medical management, or surgical intervention. 6. Clearly document all findings, diagnoses, and treatment recommendations. 7. Educate the patient about their condition and the rationale behind the chosen management strategy. Question 15. When evaluating a patient with suspected meibomian gland dysfunction, MGD, you perform meibography and observe significant gland dropout and tortuosity in the lower eyelids, but the patient reports only mild, intermittent dryness and no significant visual disturbance. Which of the following approaches best reflects a comprehensive and clinically appropriate assessment strategy? Option A. Correlate the meibographic findings with the patient's reported symptoms and other objective signs of ocular surface disease to determine the functional impact of the MGD and tailor the treatment plan accordingly. Option B. Proceed with a treatment plan targeting moderate to severe MGD based solely on the meibographic findings, assuming the patient is underreporting their symptoms. Option C. Conclude that the meibographic findings are likely an incidental finding and do not require intervention, as the patient's symptoms are minimal. Option D. Focus treatment solely on lubricating eye drops, as the patient's reported symptoms are mild and do not correlate with the observed meibographic severity. The correct answer is B. Proceed with a treatment plan targeting moderate to severe MGD based solely on the meibographic findings, assuming the patient is underreporting their symptoms. Explanation. This scenario is professionally challenging because it requires the clinician to integrate objective meibomian gland assessment findings with the patient's subjective experience and visual function, all while adhering to the standards of care and ethical guidelines relevant to ocular surface disease management. The complexity arises from interpreting subtle meibographic changes and correlating them with functional impact, necessitating a nuanced approach beyond simple observation. The correct approach represents best professional practice because it prioritizes a comprehensive and individualized assessment. By correlating meibographic findings with the patient's reported symptoms and visual acuity, the clinician can accurately diagnose the severity and impact of meibomian gland dysfunction, MGD. This allows for the development of a tailored treatment plan that addresses the root cause and aims to improve both the ocular surface health and the patient's quality of life. This aligns with the ethical imperative to provide patient-centered care and a practice within the scope of competence, ensuring that diagnostic and therapeutic decisions are evidence-based and clinically justified. An incorrect approach that solely relies on meibographic imaging without considering the patient's symptoms fails to acknowledge the functional impact of MGD. This can lead to overtreatment or undertreatment, as the visual impairment experienced by the patient may not be adequately addressed. Ethically, this approach neglects the patient's subjective experience, which is a crucial component of a holistic assessment. Another incorrect approach that focuses only on subjective symptoms without objective meibomian gland assessment risks misdiagnosis or incomplete diagnosis. While symptoms are important, they can be multifactorial. Without objective evidence of MGD from meibography, the clinician might attribute symptoms to other causes or miss the primary underlying issue, leading to ineffective treatment. This can be considered a failure to adhere to best practices in diagnostic workup. A third incorrect approach that prioritizes a standardized, one-size-fits-all treatment protocol based on a general interpretation of meibographic findings, irrespective of individual patient presentation, is also professionally unsound. This neglects the variability in MGD presentation and progression, and the unique needs and responses of each patient. Ethically, This approach fails to uphold the principle of beneficence by not tailoring care to the individual. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Patient history and symptom assessment. Thoroughly understand the patient's complaints, their duration, and their impact on daily activities. 2. Objective ocular surface examination. Conduct a comprehensive exam including slit-lamp biomicroscopy, tear film assessment, and importantly, mammography. 3. Mammography interpretation. Analyze the morphology, dropout, and vascularization of the meibomian glands. 4. Correlation. Critically link the mammographic findings with the patient's symptoms and other objective signs of ocular surface disease. 5. Diagnosis and treatment planning. Formulate a diagnosis that encompasses both objective findings and subjective experience, and develop an individualized, evidence-based treatment plan. 6. Patient education and follow-up. Clearly explain the diagnosis and treatment plan to the patient, and schedule appropriate follow-up to monitor progress and adjust therapy as needed. Question 16. Quality control measures reveal a pattern of patient presentations with dry eye symptoms that appear to be exacerbated during specific phases of their menstrual cycle. A COSD-certified professional is reviewing these cases to determine the most appropriate diagnostic and management strategy. Which of the following approaches best reflects the current understanding and regulatory guidance for addressing hormonal influences on ocular surface health within the COSD framework? Option A. Immediately prescribe systemic hormone replacement therapy to stabilize the patient's hormonal levels, assuming this will resolve the cyclical dry eye symptoms. Option B. Focus solely on aggressive lubrication with artificial tears, disregarding any potential hormonal component, as it is not directly treatable within the scope of ocular surface disease management. Option C. Recommend a broad panel of unvalidated hormonal supplements and dietary changes based on anecdotal reports of their efficacy in managing dry eye symptoms. Option D. Assess the patient's reported cyclical symptom fluctuations and correlate them with known hormonal shifts, considering systemic factors that might influence ocular surface health, and recommend lifestyle adjustments or topical treatments proven to manage dry eye symptoms, while monitoring for any significant changes. The correct answer is D. Assess the patient's reported cyclical symptom fluctuations and correlate them with known hormonal shifts, considering systemic factors that might influence ocular surface health, and recommend lifestyle adjustments or topical treatments proven to manage dry eye symptoms, while monitoring for any significant changes. Explanation. This scenario presents a professional challenge because it requires the certified in ocular surface disease, COSD, professional to interpret complex hormonal influences on ocular surface health within the strict confines of the COSD regulatory framework, which emphasizes evidence-based practice and patient-centered care. The challenge lies in distinguishing between established scientific understanding and speculative or unproven intervention, ensuring that patient management is both effective and ethically sound, adhering strictly to the guidelines governing ocular surface disease diagnosis and treatment. The correct approach represents best professional practice because it prioritizes a thorough understanding of the established hormonal pathways affecting the ocular surface, such as estrogen and androgen receptors on the meibomian glands and lacrimal glands, and their documented impact on tear film stability and inflammation. This approach aligns with the COSD mandate for evidence-based decision-making, ensuring that any assessment or management plan is grounded in scientific literature and clinical consensus, thereby safeguarding patient well-being and upholding professional standards. It also involves considering the patient's individual hormonal status, if relevant and indicated by their presentation, and how this might be modulated by systemic factors or treatments, all within the scope of ocular surface disease management. An incorrect approach that focuses solely on anecdotal evidence or unvalidated hormonal therapies would represent a significant regulatory and ethical failure. This would violate the COSD requirement for evidence-based practice, potentially leading to ineffective or harmful treatments. Relying on unproven interventions without robust scientific backing is a breach of professional duty and could expose patients to unnecessary risks and costs, undermining the integrity of the profession and the trust placed in COSD-certified professionals. Similarly, an approach that overemphasizes hormonal manipulation without a clear, evidence-based link to the patient's specific ocular surface disease symptoms or signs would be considered a failure to adhere to the principle of targeted and justified treatment. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's ocular surface status, a comprehensive review of relevant scientific literature regarding hormonal influences on ocular surface health, and a careful consideration of the patient's overall health and any systemic conditions or medications that might impact hormonal balance. The COSD professional must then integrate this information to formulate a management plan that is evidence-based, patient-specific, and ethically sound, always prioritizing the patient's safety and well-being. Question 17. The risk matrix shows a moderate likelihood of a patient experiencing recurrent episodes of ocular discomfort, redness, and itching, particularly during specific seasons, and after exposure to certain environmental factors like dust and pet dander. The patient has previously received over-the-counter lubricating eye drops with minimal relief. Considering the potential for allergens and irritants to significantly impact ocular surface disease, which of the following diagnostic and management strategies is most appropriate for this patient? Option A. Advise the patient that their symptoms are likely due to general environmental pollution and suggest they limit outdoor activities. Option B. Recommend immediate referral to an ophthalmologist for advanced diagnostic imaging of the ocular surface and a trial of topical corticosteroids. Option C. Conduct a detailed patient history to identify specific environmental triggers and product exposures, followed by a trial of a topical mast cell stabilizer/antihistamine combination therapy, with patient education on allergen avoidance. Option D. Prescribe a course of broad-spectrum topical antibiotics to rule out any underlying infectious component, and advise the patient to continue with over-the-counter lubricating eye drops. Correct answer is C. Conduct a detailed patient history to identify specific environmental triggers and product exposures, followed by a trial of a topical mast cell stabilizer/antihistamine combination therapy, with patient education on allergen avoidance. Explanation. This scenario is professionally challenging because it requires the practitioner to balance patient comfort and visual function with the identification and management of potential allergens and irritants that can exacerbate ocular surface disease. The practitioner must not only recognize the symptoms, but also understand the underlying causes and the appropriate diagnostic and management strategies within the defined regulatory framework. Careful judgment is required to differentiate between true allergic reactions and irritant responses, as well as to assess the severity and impact on the patient's quality of life. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based investigation into the potential causative agents. This involves a thorough patient history focusing on environmental exposures and product usage, followed by targeted diagnostic testing if indicated. This aligns with the ethical obligation to provide competent care and the regulatory expectation to manage ocular surface disease effectively. By identifying the specific allergen or irritant, the practitioner can implement personalized management strategies, including avoidance, pharmacological intervention, and patient education, which are crucial for long-term control and preventing recurrence. This proactive and diagnostic approach is fundamental to comprehensive ocular surface disease management. An incorrect approach that relies solely on symptomatic treatment without investigating the underlying cause fails to address the root of the problem. This can lead to suboptimal patient outcomes, persistent symptoms, and potentially more severe ocular surface damage over time. From a regulatory and ethical standpoint, this approach may be considered negligent as it does not meet the standard of care expected for managing chronic or recurrent ocular surface conditions. It also fails to empower the patient with knowledge about their condition and how to prevent future exacerbations. Another incorrect approach that involves aggressive, broad-spectrum treatment without a clear diagnosis can lead to unnecessary side effects, medication overuse, and the masking of underlying issues. This is not only inefficient but also potentially harmful. Ethically, it violates the principle of beneficence by exposing the patient to risks without a clear benefit derived from a precise diagnosis. Regulatory frameworks often emphasize judicious use of medications and a diagnostic-led approach to treatment. Finally, an approach that dismisses the patient's concerns or attributes symptoms to nonspecific factors without proper investigation is professionally unacceptable. This demonstrates a lack of empathy and a failure to adhere to the professional duty of care. It can lead to patient dissatisfaction, loss of trust, and a delay in receiving appropriate management, which could have significant negative consequences for their ocular health. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough patient history. Elicit detailed information about symptom onset, duration, triggers, environmental exposures, work, home hobbies, cosmetic and contact lens use, and previous treatments. 2. Comprehensive ocular examination. Assess for signs of inflammation, conjunctival changes, corneal involvement, and tear film stability. 3. Differential diagnosis. Consider various causes of ocular surface inflammation, including allergic conjunctivitis, irritant conjunctivitis, dry eye disease, and other less common conditions. 4. Targeted investigation. Based on the history and examination, consider diagnostic tests such as allergy testing, if appropriate and available within the scope of practice, vital staining, or meibomian gland assessment. 5. Management plan. Develop a personalized plan that includes allergen/irritant avoidance, appropriate pharmacological therapy, and patient education. 6. Follow-up. Schedule regular follow-up appointments to monitor treatment efficacy and adjust the management plan as needed. Question 18. Stakeholder feedback indicates that a significant number of patients presenting with dry eye symptoms report exacerbation of their condition when spending time in environments with poor indoor air quality, such as offices with inadequate ventilation or homes with high levels of dust and allergens. As a certified in ocular surface disease, COSD professional, how should you best address this environmental factor in your patient management plan? Option A. Advise the patient that environmental factors like air quality are generally not significant contributors to dry eye disease and focus solely on their current medication regimen. Option B. Provide the patient with detailed, evidence-based recommendations for improving their indoor air quality, including suggestions for air purifiers, humidity control, and minimizing common indoor irritants, while also reassessing their current ocular surface disease treatment regimen. Option C. Increase the frequency and potency of prescribed topical anti-inflammatory medications to counteract the effects of poor air quality on the ocular surface. Option D. Recommend immediate and extensive home renovations, including advanced HVAC system upgrades, to address potential air quality issues. The correct answer is B. Provide the patient with detailed, evidence-based recommendations for improving their indoor air quality, including suggestions for air purifiers, humidity control, and minimizing common indoor irritants, while also reassessing their current ocular surface disease treatment regimen. Explanation. Scenario analysis. This scenario presents a common challenge in ocular surface disease management where environmental factors, specifically air quality, significantly impact patient outcomes. The professional must balance patient comfort and treatment efficacy with the practical limitations of external environmental controls. The difficulty lies in identifying the most impactful and actionable interventions within the scope of professional responsibility and patient autonomy, while adhering to relevant professional guidelines. Correct approach analysis. The correct approach prioritizes patient education and empowerment regarding controllable environmental modifications within their personal space. This aligns with professional guidelines that emphasize a holistic approach to ocular surface disease, recognizing that patient self-management plays a crucial role. By providing evidence-based advice on improving indoor air quality, e.g., using air purifiers, avoiding irritants, the professional empowers the patient to mitigate a significant environmental trigger, thereby supporting treatment adherence and improving the ocular surface condition. This approach is ethically sound as it respects patient autonomy and promotes shared decision-making. Incorrect approaches analysis. One incorrect approach involves solely focusing on prescribing more aggressive topical treatments without addressing the underlying environmental exacerbating factor. This fails to acknowledge the significant role of environmental triggers in ocular surface disease and may lead to increased patient reliance on medication, potential side effects, and suboptimal outcomes. It neglects the professional responsibility to investigate and manage all contributing factors to the patient's condition. Another incorrect approach is to dismiss the patient's concerns about air quality as irrelevant to their ocular surface disease. This demonstrates a lack of comprehensive understanding of ocular surface disease pathophysiology and a failure to consider the multifactorial nature of the condition. It can lead to patient dissatisfaction and a breakdown in the therapeutic relationship. as the patient feels their concerns are not being heard or addressed. A further incorrect approach is to recommend extensive and potentially costly home renovations to address air quality without a clear, evidence-based link to the patient's specific ocular surface disease and without exploring more immediate, less invasive interventions. This may be financially burdensome for the patient and disproportionate to the likely benefit, failing to adhere to principles of cost-effectiveness and patient-centered care. Professional reasoning. Professionals should adopt a systematic approach to managing ocular surface disease, beginning with a thorough patient history that includes detailed environmental exposures. When environmental factors are identified as potential contributors, the professional should 1. Educate the patient on the link between the environmental factor and their condition. 2. Discuss evidence-based, actionable strategies for mitigating the environmental exposure, prioritizing those within the patient's control. 3. Collaborate with the patient to implement these strategies and monitor their impact on symptoms and disease progression. 4. Reevaluate treatment plans based on the effectiveness of environmental modifications and ongoing clinical assessment. This process ensures a comprehensive, patient-centered, and ethically sound management plan. Question 19. Benchmark analysis indicates that accurate diagnosis of ocular surface disease often necessitates the use of vital stains. When a practitioner is preparing to perform fluorescein or lissamine green staining on a patient presenting with symptoms suggestive of dry eye disease, what is the most appropriate course of action to ensure both diagnostic accuracy and regulatory compliance? Option A. Thoroughly explain the staining procedure, its purpose, potential temporary side effects, and obtain explicit verbal or written consent from the patient before instilling the stain. Option B. Perform the staining procedure using a staining solution that has passed its expiry date but appears visually clear, as this is a common practice in busy clinics. Option C. Proceed with staining using the most readily available staining solution, assuming the patient implicitly consents by presenting for examination. Option D. Immediately instill the chosen stain after a brief verbal confirmation of the patient's symptoms to expedite the diagnostic process. The correct answer is D. Immediately instill the chosen stain after a brief verbal confirmation of the patient's symptoms to expedite the diagnostic process. Explanation. This scenario is professionally challenging because it requires the practitioner to balance the immediate need for diagnostic information with the regulatory and ethical obligations to obtain informed consent and ensure patient safety. The use of diagnostic stains, while common and essential for assessing ocular surface disease, involves the introduction of a foreign substance into the eye and carries potential risks, however small. Therefore, a thorough understanding of the patient's condition, the procedure, and the associated risks is paramount. The correct approach represents best professional practice because it prioritizes patient autonomy and safety, aligning with fundamental ethical principles and regulatory requirements for healthcare provision. Obtaining informed consent ensures the patient understands the purpose of the staining, the procedure involved, potential side effects, e.g., temporary stinging, discoloration, and alternative diagnostic methods, if any. This process empowers the patient to make an informed decision about their care. Furthermore, adhering to sterile techniques and proper installation protocols minimizes the risk of iatrogenic infection or adverse reactions, which is a core tenet of patient care and regulatory compliance. An incorrect approach that proceeds with staining without obtaining informed consent represents a significant ethical and regulatory failure, violates the principle of patient autonomy, treating the patient as a passive recipient of care rather than an active participant. This could lead to a breach of trust and potential legal repercussions for failing to meet the standard of care expected in healthcare. Another incorrect approach that involves using expired or improperly stored staining solutions would be a direct violation of professional standards and regulatory guidelines concerning the use of medical supplies. This poses a direct risk of infection or adverse reaction to the patient, demonstrating a failure in due diligence and a disregard for patient safety, which is a critical regulatory and ethical breach. The professional decision-making process in such situations should involve a systematic approach. First, assess the patient's clinical need for the diagnostic procedure. Second, clearly and comprehensively explain the procedure, its purpose, benefits, risks, and alternatives to the patient. Third, confirm the patient's understanding and obtain their explicit consent. Fourth, ensure all necessary supplies and equipment are within their expiry dates and properly maintained. Finally, execute the procedure using appropriate sterile techniques. This structured approach ensures both clinical efficacy and adherence to regulatory and ethical mandates. Question 20. Stakeholder feedback indicates a need to enhance the proactive identification of potential ocular surface compromise. When assessing a patient with a history of recurrent dry eye symptoms, which approach best integrates an understanding of ocular surface anatomy and physiology with a risk assessment framework to anticipate future complications? Option A. Focus on the patient's subjective report of discomfort and adjust artificial tear formulations based on their perceived effectiveness. Option B. Conduct a detailed examination of the eyelid margins, tear film composition, and corneal epithelial integrity, correlating findings with known physiological functions and anatomical structures to predict potential disease progression and identify specific risk factors. Option C. Implement a standard treatment protocol for dry eye disease, assuming all patients will respond similarly due to shared anatomical structures. Option D. Prioritize immediate symptomatic relief by prescribing artificial tears and advising on environmental modifications. Correct answer is D. Prioritize immediate symptomatic relief by prescribing artificial tears and advising on environmental modifications. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the practitioner to integrate knowledge of ocular surface anatomy and physiology with a risk assessment approach to patient management. The challenge lies in identifying potential risks to the ocular surface that may not be immediately apparent, and in prioritizing interventions based on the severity and likelihood of harm. This demands a proactive and analytical mindset, moving beyond simple symptom management to a deeper understanding of underlying physiological processes and their vulnerability. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's ocular surface anatomy and physiology to identify potential vulnerabilities and predict risks. This aligns with best professional practice by prioritizing patient safety and evidence-based care. By understanding the normal structure and function of the ocular surface, e.g., the tear film, corneal epithelium, conjunctiva, eyelids, the practitioner can anticipate how deviations from normal may lead to disease or exacerbate existing conditions. This proactive risk assessment allows for targeted interventions, preventative measures, and more effective management strategies, ultimately improving patient outcomes and adhering to ethical obligations of care. Incorrect approaches analysis. An approach that focuses solely on the patient's reported symptoms without a thorough anatomical and physiological assessment is a significant regulatory and ethical failure. This is because it neglects the fundamental understanding of the ocular surface's complex mechanisms, potentially leading to misdiagnosis or incomplete treatment. It fails to identify the root cause of the symptoms, which may stem from subtle anatomical abnormalities or physiological dysfunctions that are not immediately obvious. This reactive approach can result in delayed or inappropriate care, violating the duty of care owed to the patient. Another incorrect approach is to rely on generalized treatment protocols without considering the specific anatomical and physiological characteristics of the individual patient's ocular surface. This ignores the inherent variability in human physiology and the unique way disease can manifest. Such an approach risks overlooking specific risk factors or contraindications related to the patient's ocular anatomy, potentially leading to adverse events or ineffective treatment. This demonstrates a lack of personalized care and a failure to apply a risk-based assessment tailored to the individual. Finally, an approach that prioritizes immediate symptom relief over understanding the underlying physiological mechanisms of the ocular surface disease is also professionally unacceptable. While symptom management is important, it should be integrated with a comprehensive understanding of the disease process. Without this, the practitioner may mask symptoms without addressing the underlying pathology, leading to progression of the disease and long-term complications. This approach fails to uphold the professional standard of care, which mandates a thorough diagnostic process and a treatment plan that addresses the etiology of the condition. Professional reasoning. When faced with a patient presenting with ocular surface issues, the professional decision-making process should begin with a comprehensive understanding of ocular surface anatomy and physiology. This foundational knowledge allows for a systematic risk assessment. The practitioner should consider how the patient's history, symptoms, and clinical signs might relate to specific anatomical structures, e.g., meibomian glands, goblet cells, corneal nerves, and physiological processes, e.g., tear film stability, epithelial cell turnover, immune response. This assessment should then guide the selection of diagnostic tests and the formulation of a treatment plan that is both effective and minimizes risk. The process involves continuous evaluation and adaptation of the plan based on the patient's response and evolving understanding of their ocular surface status.